Hello, and welcome. Today we're diving into the rare but potentially serious heart condition known as short QT syndrome, or SQTS. We'll explore what it is, what causes it, how it affects the heart, and what can be done about it. Short QT syndrome is primarily a genetic disorder. This means it's caused by mutations in genes that control the flow of ions, specifically potassium, calcium, and sodium through the heart's electrical cells. These mutations disrupt the normal repolarization process of the heart. While most cases are inherited, occurring in families with a history of the condition, spontaneous mutations can also occur, meaning someone can develop SQTS without a known family history. To understand short QT syndrome, it's helpful to understand the heart's electrical system. Each heartbeat is triggered by an electrical impulse that travels through the heart. The QT interval on an electrocardiogram, or EKG, represents the time it takes for the heart's ventricles to depolarize, contract, and then repolarize, relax. In short QT syndrome, this repolarization happens much faster than normal, shortening the QT interval. This abbreviated QT interval makes the heart more susceptible to developing dangerous, rapid heart rhythms known as arrhythmias. These arrhythmias, particularly ventricular fibrillation, can lead to sudden cardiac arrest. Short QT syndrome is a rare condition. Precise prevalence is difficult to establish, but it is estimated to affect a very small percentage of the population. Because it's a genetic disorder, it can be found in people of any ethnicity or geographic location. Due to its potential for sudden cardiac death, especially in younger individuals, it is important to recognize and diagnose it appropriately. Many individuals with short QT syndrome are asymptomatic, meaning they experience no noticeable symptoms. However, the condition can manifest in a variety of ways. The most concerning symptom is syncope, or fainting, which is often triggered by physical exertion or emotional stress. Palpitations, a sensation of rapid, fluttering, or pounding heartbeats, can also occur. In the most severe cases, short QT syndrome can lead to sudden cardiac arrest, which, if not treated immediately, can be fatal. Diagnosing short QT syndrome can be challenging. The primary diagnostic tool is the electrocardiogram, or EKG. A consistently shortened QT interval, typically less than 30-50 milliseconds, is a key indicator. However, QT intervals can vary, so multiple EKGs may be needed. Genetic testing can help confirm the diagnosis by identifying specific gene mutations associated with the syndrome. Electrophysiological studies, which involve inserting catheters into the heart to measure electrical activity, can also be used to assess the heart's vulnerability to arrhythmias. While short QT syndrome doesn't have distinct subtypes in the traditional sense, it is associated with different genetic mutations. The specific gene affected can influence the severity of the condition and the response to treatment. For instance, mutations in gene KCNH2, KCNQ1, and KCNJ2 have been implicated in short QT syndrome, with each gene playing a different role in potassium channel function. The primary goal of treatment is to prevent life-threatening arrhythmias. The most effective treatment is an implantable cardioverter defibrillator, or ICD. This device is surgically implanted in the chest and continuously monitors the heart's rhythm. If it detects a dangerous arrhythmia, it delivers an electrical shock to restore a normal heartbeat. Certain medications, such as quinidine, can also be used to prolong the QT interval and reduce the risk of arrhythmias, although its use is less common than ICD implantation due to side effects and potential for complications. Lifestyle modifications, such as avoiding strenuous exercise and stress, may also be recommended. As short QT syndrome is a genetic condition, primary prevention, in the sense of completely eliminating the risk of developing the disorder, is not currently possible. However, genetic counseling and testing can be offered to individuals with a family history of short QT syndrome. This can help them understand their risk and make informed decisions about family planning. Secondary prevention, which focuses on preventing complications in those already diagnosed, involves regular monitoring, adherence to prescribed medications, and ICD implantation when appropriate. The prognosis for individuals with short QT syndrome varies. Some individuals may remain asymptomatic throughout their lives, while others are at a higher risk of sudden cardiac arrest. Early diagnosis and appropriate treatment with an ICD can significantly improve the prognosis. Recent research is focused on developing more targeted therapies that address the specific genetic mutations underlying the syndrome. Studies are also exploring the use of risk stratification tools to better identify individuals who are at the highest risk of life-threatening arrhythmias and tailoring treatment accordingly. Furthermore, investigation into novel pharmacological agents is ongoing, aiming to provide safer and more effective alternatives to current medications.